Hello and welcome to 12 to Your Health. I'm your host, Dr. DeSilva. Having to have surgery can be a little scary, but luckily, Dr. Ayotunde Adeyeri is here today to offer some advice on how to make the process much smoother. He's board certified. He's a board certified laparoscopic, bariatric, and general surgeon. Welcome to the program.
Thank you, Dr. DeSilva.
Pleasure to have you here. So, what do people need to do to prepare for surgery?
Surgery is a very big deal because, you know, it is surgery. And there are many things you need to know before surgery, which you would have been told about prior to surgery by your surgeons and the other physicians involved. It's important to make sure that you go through all the instructions that you were given correctly. On the day you come into surgery, it's important to come to the hospital, pack a bag, because even if you're having surgery that you're expected to go home the same day, sometimes it doesn't always go that way.
Right. You know, what I tell people is read what they gave you, ask the questions, and do what you can to, you know, to get that prepared. But what about eating and drinking prior to surgery? What's the advice to people? We generally do not want you to eat or drink at least 6 to 8 hours before surgery. And why is that?
This is because for most surgeries, if you're going to have general anesthesia, you're going to be put to sleep.
Right.
And when we put you to sleep, we have to put in a breathing tube to breathe for you. During the act of putting in that tube, we do not want your stomach to be full, or you could vomit and aspirate, and this could cause serious complications after surgery. And so that's why we do not want your stomach to be full for you to eat anything seriously. However, I know some patients, in my experience, some patients don't always comply.
Sure. My
advice is, when you come in the morning, even if you've eaten, don't hide it from me.
Tell me.
Know.
Absolutely. Better to advise than to be advised of than not know. Somebody going to surgery, they're nervous, they're anxious. What is the 1-2 thing that they can do to really prepare? I know I asked you this before, but what else?
It's very important to make sure that they are well informed about the surgery. In my experience, the most informed patient is always more relaxed than the less informed patient.
It's a great point. And what about anesthesia?
Anesthesia.
Are there options?
There are options for anesthesia, but it depends on what kind of procedure you're having. Some procedures can only be done under certain types of anesthesia, like major complex abdominal procedures need to be done under general anesthesia. However, there's some other procedures that can be done with different types of anesthesia, and at that point, you have choices. You know, these are choices that will be discussed with you before surgery, and, you know, risks and benefits of each approach will be discussed with you, and you can make an informed decision.
Thank you very much for joining us.
Thank you.
Great advice. Thank you for being here. Hello and welcome to 12 to Your Health. I'm your host, Dr. DeSilva. We're continuing our discussion today on what you need to know before and after surgery. Joining us once again is board certified surgeon, Dr. Ayotunde Adeyeri. Thank you once again for being here. Do appreciate it.
Thank you.
You know, we talked last week about what you need to do before surgery. What about after surgery? What are some of the things that we need to be aware of?
First of all, do all the things you were told at discharge. That's always a good idea. But importantly, there's some specific things that we usually want you to do to prevent complications that can occur after surgery. One of them is using a machine called an incentive spirometer, which helps to prevent you from having pneumonia if you've had surgery under general anesthesia. Right.
And actually, we have some video of that, so we're going to show that in just a bit. Oh, here it is. Can you just tell us what's going on here?
That machine there is called an incentive spirometer. She's putting it together, and she's going to use it. And what happens is you suck in on that long tube there. Right. And the
little ball in there?
The little ball in there goes up. The measurements there to show the volume in which you're inspirating. Right. And this helps to re-expand your lungs, typically to help prevent pneumonia after surgery from general anesthesia.
And is it because, and what's the reason for that?
Well, when we put you to sleep under general anesthesia and we breathe for you with the machine, we can't put in too much air to overinflate your lungs and pop your lungs. I see. So typically, and you're always lying on your back, so typically some segments of the lungs will be collapsed after the procedure.
Is that related to how long you've been under anesthesia? The longer the anesthesia, the worse, or doesn't it matter?
To an extent, it does matter, but it's not the only factor.
I see.
Just the fact that you're intubated and have general anesthesia gives you potentially some amount of risk to this.
Right.
But yes, longer anesthesia does increase.
So use the spirometer. What about blood clots? People always worry about that.
Blood clots are a concern that can happen after surgery. How do we prevent blood clots? We make sure that, one, after surgery, depending on the type of surgery, but after most surgery, we tend to get you up and around quickly. We give you blood thinners if needed. And prior to surgery, part of preparing for surgery is you discuss with your surgeons what medications you're taking, so we stop medications that we think can promote blood clots. And it's important to get up and walk around when you're told to, and not just go home and lie in bed all day. That's when disasters happen.
Follow the directions of what the doctors and nurses told you after the surgery. I think that's the bottom line. Thank you so much once again for your time.
Thank you
very much for joining us.